Hi everyone, welcome to part 2, PP Therapy, Shivambu, Urine Therapy. We're going to get into some practical ways that you can use it today. So we're going to bring Tom in here in just a moment. So go ahead and you guys can pop in your questions if you like. We'll try to answer them, but we're probably going to get into a bit of a flow. So pop your questions in anyways, and we'll see which ones we can get to. There we go. Hey, welcome.
Thank you. Good to see you.
Yeah, good to see you too. So yeah, our previous talk, it got definitely a lot of views, a lot of people commenting on it and sharing it, and yeah, kind of getting the conversation going, which is really great.
Yeah. Heaps of people liked it. Yeah. It was super funny though, because you see some people going, I can't believe you two are talking about this. I thought you were, and they're like, it's a waste. I'm like, dude, listen to it. We like every time we do one, it's like it's not a waste product. Like there's some people are stuck on that. I mean, one or two people.
Yeah.
There's so many people that are switching onto this sort of stuff. Yeah, it's pretty cool. I love it.
Yeah. Well, it's funny, like PP therapy, urine therapy is getting a bit of a renaissance, I guess, right? Like it's getting trendy. And it is kind of associated with extreme vegans, which
Mhm.
we don't want to be extreme, in any way, really. But
Yeah.
yeah, but anyone can practice it, as long as your diet is really clean and you're taking care of yourself. Um, yeah. So anyways, yeah, that's something else I wanted to kind of mention to everyone, that this therapy is old. It's probably, I think it has its roots originally in Ayurveda, but it could even have gone before that. Many people have used urine therapy to survive in certain situations, like when there's no
Mhm.
water, like if you're like lost at sea. There was a couple stories I came across of a man that was found lost at sea for like 4 months, and he was healthy and in good spirits when they found him.
Yeah.
Yeah, yeah, it is.
Yeah.
It's really incredible.
Yep.
So Tom, tell me, so have you practiced a couple of different urine therapy things since we last had our talk last week?
Um, yeah, well, I tried a foot soak since last week, but like I say, I'm not like it's not an everyday thing for me. But there's I've got a few theories about different things as well, with different ways to use it that I haven't really heard people talk about, even though it's probably already a thing. But for example, um, I was having a chat with somebody after we did our live, and they were talking about just general hormonal health, libido, strength, just feeling strong inside. Just hormones are out. And I'm like, well, what if the code for the hormones is in the pee after you've stimulated? So this is a guy. So I said, why don't you try like being aroused and having some activity, and then shortly after drinking your pee? Because I was like, he thought I was nuts, but I was like, no, go watch some of the stuff. I sent him the live that we did, and I sent the one that I did with Amanda, and I said, just watch that and then see what you think. Especially talking about the bee stings and how the body produces the, whatever. So anyway, he actually tried that, and he said he definitely felt more robust from doing it, because he had more, I guess, free flowing testosterone in his body from the activity, and then that must have coated the weed. Of course, could have been some kind of placebo effect from thinking it was going to do that. So it's kind of trialing it out over a period of time. We'll see, but the initial reports are that it's had a positive effect, and that's not drinking a lot. That was drinking like quite a small amount, just like that, like I was talking about last time, that therapeutic or you know, yeah, what's the word for it? The
Oh, homeopathic.
yeah, the homeopathic, yeah,
Yeah,
element.
yeah,
And I
very
saw that
cool.
video you sent about the snorting, but I didn't try that. Have you tried that one?
I have, yeah. So I originally did a neti pot with it, which they call
Mm-hmm.
Amaroli neti. And so I originally did that, and that felt like a normal neti pot. It was great. But then the sniffing, there's almost something like different about it, because you're like drawing it up, and it kind of it is uncomfortable because it kind of reminds me of, you know, getting water in my nose when I was learning to swim as a kid and stuff, and getting like overwhelmed. But anyways, no, it's really interesting to sniff it, and then yeah, you just allow it to kind of go down your throat, and apparently it is the fastest way to the vagus nerve to stimulate your vagus nerve, and yeah, and it really clears your sinuses. It feels amazing. It feels really, really clear. So that is one way that you can utilize it. And it's incredible because urine is like the perfect, because it's our blood plasma, it's the perfect, you know, electrolyte balance for our tissues. So that's why you can put it on your eyes and your eyes don't sting, or you can sniff it and it's not, doesn't really sting that much, because it's the perfect liquid for our tissues. So, and that's why it's so moisturizing too, as well.
Yep. Yeah.
Yeah.
It's powerful.
So something I wanted to mention too, you said placebo effect. So that has been kind of ruled out by the studies that were done with animals. So they used urine therapy with animals, and of course the animals don't have any idea that this is going to heal them, right? So, but it does work with animals. So it kind of rules out the idea that urine therapy could be strictly a placebo effect, where you're just thinking like, oh, my urine's going to heal me, and then the power of belief, which is very powerful, can heal. But they ruled it out with the animal studies, seeing that animals improved on the PP therapy. So
Exactly. Yeah. Yeah. It's yeah. It's, you can't. That's the thing. You can't argue with the results. Like, even people who think it's gross or it won't work, if you give them the skin therapy, for example, it heals no matter what, even if they believe that it doesn't. So that does rule out the placebo. But it's just that if somebody does take a small amount and gets, like, you can't tell that it's the urine that did the hormonal increase, or if that was just believing that it would. That's what I mean. Like, so there is placebo in that, because it's not necessarily a healing. Like, no, there's no healing that's occurred, you know, like, so yeah, I think that's the differentiation. But totally, it's like placebo's been ruled out with urine therapy in general for a long time.
Yeah, very cool. So yeah, so other like ways that people can kind of like begin with this, which are just really, you know, it's just a way to kind of get your feet wet without really diving right in. As we said before, you could do a foot soak, which is incredible. I know that every time at change of seasons, my feet, in the past, they would get like dry and peely sometimes. That's cleared up in the last couple of years that I've really been putting effort towards my health. But I know that a urine soak, especially like 3-4 days old urine, can really, really help with cracked feet and yeah, and dry feet. So
yeah.
Foot bath is an amazing way to start. Sniffing, getting like one of these little eye cups you can order online. You can get them at health food stores. Fill it up, and you can use it in your eyes. You can use it as a rinse, like almost like, you know, if you're dealing with dental issues, it has been said to work with your teeth and helping just your teeth health. So you could swish with it. Ears, you can do ear drops as well. If you have like an earache, you can just warm it up a little bit and do ear drops. Hair, it's like amazing for your hair. Really, really, like we said, the urea in urine has this ability to go a little bit deeper into the skin, and you feel that kind of tingling sensation, and that's the urea bringing that moisture in and all of the nutrients and hormones a little bit deeper than any lipid, fat, shea butter or whatever that you're going to put on your skin. And so same thing with your hair and your hair follicles. Like, it can really stimulate hair growth and just have really, really strong hair, and really, really soft as well.
You have to try that. Try regrowing a whole, get some dreadlocks and stuff.
Yeah. You could do a beard soak, Tom.
No, I do. Yeah, I just don't do it often, and that's the thing. It's like interesting that even knowing the benefits, right? And I've experimented myself and experienced the benefits, and then like I just don't do it that often. But part of it is because I'm not very stable. Like I haven't had I'm about to get my own place in a week, which I'll actually have for an extended period of time, which would be great. And that's when I will be able to do more stuff. And, but I've definitely noticed that this is a great topic actually, because when people are wondering about it and they still might think urine's gross kind of thing, in the shower is a great place to experiment with it, because if you're putting it on your skin or your hair or whatever, it's literally kind of rinsing straight off. So you're not going to get lingering any scent or anything like that. Like it's a safe way for people to do it. But it just needs to become a bit of a routine, right? Like a habit. Like if it's something that's so foreign to you, you don't even think to do it. You've got to do it for a few weeks straight. And then it's like, yeah, using my fluids is a part of my daily life. But, you know, it's like a lot of people do that. They're like, oh, this exercise you can do helps, you know, with your neck or your knees or something. And they'll try it once from watching a YouTube video and then they forget about it. Like it's not part of their life or their routine. So I think the shower is a good place to start for people who are worried about urine in some ways. But I was doing that when I had a shower, was I would use coconut oil and I'd wee in a glass and I'd mix it together. And especially if you're using hot water, the coconut oil's nice and, you know, liquid-like, and then I'd rub that in and I'd leave it in there while I then showered and washed myself, and then I'd rinse it out at the end, and it's super soft in the beard and stuff.
Oh wow, yeah, that's a great little hack, mixing it with coconut oil like that.
Yeah. And in case anyone's wondering, no, you can't smell urine. It's like fresh urine just doesn't. It's like, yeah, you don't smell like you've peed yourself or something.
Yeah, it kind of like mixes with your own chemistry, and you know, it's not really that unpleasant, and yeah, it evaporates and you don't smell it after a little while. So yeah, like you said, make it part of, you know, to make it part of your lifestyle if you want to, and you know, put some jars next to your toilet, and quite a few jars, because you know might decide to catch all of your urine in one day and then do a foot soak, or you know, do a hair soak. And so what I do often, I have like a I guess a foot soak tub with some jars in it. And then if I'm gonna have a shower, I'll shower first, and then I will warm up urine that's like in a jar, put hot water around it in the tub, in the little foot tub, and have my shower, and then do massage it, put it in my hair, massage it all over. You know, if I have time that day, like I'll try to do that for 15 minutes, you know, extend it out. And by the way, rubbing it on your skin was an integral part of John Armstrong's protocol. It was very important to utilize it through transdermally, like through your skin, as well as ingesting it, because of the hormones.
Maybe, does he recommend a carrier oil or something as well? So, you know, like for example, castor oil is really penetrative. But I remember last chat you said the urine is more penetrative than anything else, right? So I'm wondering, do they recommend, because I used it in my beard with coconut oil, do they say to not have it with an oil because it might even prevent it penetrating, or can the oil help it sit better? Like, is there any mention of any carrier substance, or just urine by itself, nothing else?
I haven't heard any mention of carrier oils in any of the 3 books that I've read. But if urea does kind of have this ability to go deeper, then it might carry with it, you know, some of these different oils. But I know John Armstrong was very keen to be like strict with that everything was just urine. Even when the patient might have convinced him to let them have some carrot juice, like raw carrot juice, it ended up being disastrous. They ended up having a rash, et cetera, et cetera. So at least in John Armstrong's protocol, he was very like strict that it was just urine. But sometimes he would use, if it was a female patient and she had a female nurse, sometimes they would use cloths soaked in the nurse's urine on the patient to aid in their therapy.
Mm-hmm.
So interesting that you can use someone else's urine.
Yeah. I'm wondering too, just about, you know, he said you warm it up. So basically urine would come out of your body at around 37 centigrade or 98.3 is that Fahrenheit, whatever one. I don't know what it is. No, 98.6 or something, whatever it is. Do you know if it's supposed to be at that temperature to have some other, like once a substance is at a certain temperature and then it's cool or heated, it changes its properties in some ways. So I'm wondering if it's meant to be at body temperature. So if it is, you know, stored in a jar, does it have a better effect if you then heat it back up gently, like you do with the hot water around it, to body temperature? Or is it just as effective stored and cold and rubbed on your skin?
You know, that's a really good question. I would assume that warming it to the original temperature it was when it came out would probably be the most beneficial. In some of the texts, it talks about, especially in the Indian therapy, they talk about boiling it and then using it. And I thought, well, that's kind of, I don't know, you might be like, you know, getting rid of maybe some enzymes or things like that that are part of it. So, you know, that might be useful in some kind of way, but I would say, you know, that as close as it is to when it first comes out of you is probably the best temperature. Yeah.
Yeah, right. Yeah, but I just didn't know. Makes sense, but I don't know.
Yeah. So, okay. So, I'll address one of the questions that I got. Someone is actually saying here in the chat too, what is the name of the book? The book is The Water of Life, a treatise on urine therapy. And so this was by John Armstrong, who was a layman, as in he wasn't a doctor, in the 1900s, so like 1915, 1920. And he helped people who were like on the brink of death come back from that and be completely healed. So one of the questions that came in was from Tommy Gallant. He says, hi, something that you guys talked about but didn't really fully address is if in a compromised low frequency state, would your urine be not beneficial and even harmful? Would it be best to heal first and then the urine would be more optimal? That's what I would think, but I'm not sure. That would be unfortunate because most people who would actually need the urine to heal wouldn't have the most ideal urine because they're not well. And he says, I hope you'll tell me and advise, can I drink my urine if not at my best state?
Mm-hmm.
So yeah, that's like a valid question for sure, you know, but we all have sort of a starting place as well, right? So, you know, you're going to try and improve your health and then do urine therapy. Well, I can tell you, at least in this book, a certain patient was actually, she had like terrible, and this was a few different times in this book that the patients had terrible, terrible, foul, like awful urine, and they were so unwell. But John Armstrong encouraged them to start drinking. So I'll just read just a tiny bit here from this book. So here's a case. Mrs. C, aged in early 40s, given 2 days to live by doctors. Breathing somewhat difficult, urine very scanty, which means very little, thick and looking like a mixture of blood and pus. She had been a very fine specimen of a woman, judging from her photographs taken a year or so previously. She was like 280 pounds, but she was normally 144, so she was like double the size that she should be. In spite of the doctor's verdict, however, I did not think she looked like a dying woman. So, and then he goes on to say that, yeah, within just a week of drinking, the effect was so powerful, it began to break up congestions in every part of her body. So within 4 days, the flow of urine had increased from a bare 2 ounces, and it was very high in aroma, thick, hot, cloudy, and full of casts, to about 200 ounces in 24 hours. Moreover, it began to change into much clearer, far more freely expressed liquid, gradually approaching the appearance of rainwater. By the 4th day after drinking every drop she passed, it was practically tasteless, free from odor, and in no sense of the word objectionable.
Mm-hmm.
And she did a 48-day urine looping fast, which means she just, no food, no, maybe a little bit of water, but it was just drinking every drop that she passed. And she healed, and she was given 2 days to live by doctors, and he was able to cure her, and she walked out of that clinic in clothes that she wore a year previously, because her because she lost so much weight.
Mm-hmm.
She was back to a normal weight for her, which was 144 pounds.
Mm.
So yeah, so to answer your question, Tommy Gallant, you know, always listen to your body, but from the experiences in this book, which I think you should definitely get, it looks like you can dive in and start to work with it, even if you're in a terrible state.
Yeah, I'd agree. I think that's pretty much what I was going to say. I was just thinking though, there's probably like there's always, you know, different levels to it. And I think if the body is not healthy, but you are continuing to make it not healthy by your internal state, you're probably going to structure it to be pretty bad. But if you're currently not, you know, like your urine, like he said, isn't at a high frequency, for example, that is, I think the frequency will change if you make the decision to heal. And that will mean that if you make that decision, you're not going to be like mainlining heroin into your arms and eating McDonald's and stuff, trying to heal. Like you might be unhealthy now, but as soon as you go, I'm going to heal. And then then you're changing better quality water, better quality food, spending time to meditate, doing all the good stuff. And then drinking your urine, even if it's not technically at a high frequency, I think my theory is it's then encoded with it's good to drink. And that, like this lady you're talking about, obviously she's at death's door and she's like, all right, I'll do this, but you're only going to choose to drink your own pee for 2 months straight if you're choosing to live, right? Like if you're in a state of whatever, you're not gonna do that. So to me, it's that state of being has changed, and that recodes the urine into something. Even though the physical health isn't good, the subtle body, the subtle energy is now changed to life positive or life affirmative, and then that's what you're drinking. So it will be at a higher frequency and provide the code to reach that higher physical frequency as well. That's my thoughts on it. I think, yeah. And it's funny because we've spoken about this before, where it's people who get to that stage that then find out about miraculous healing. Like no one would eat poo normally, for example, but like people who have had really, really bad guts, can't do anything about it, have gone and eaten the like sheep droppings and that and healed guts that don't work, you know, and people get fecal implants and that sort of stuff. So all the stuff that we would think is horrible or gross or too extreme, it takes people who have no option. They have to choose, am I going to live or am I going to die? And then through that decision process, they find like, oh, wow, there's all this stuff that's out there that is just a change of mentality, for example. But realistically, I think that that's a big part of the healing, more so than just the urine. You know what I mean?
Right. Yeah. So it would be both. Yeah, absolutely. Yeah.
But the short answer is if you're technically unhealthy, as long as you're deciding to move forward and you're doing other stuff to move, even if you only looped, you didn't even eat organic food and all that, then I think I would, like, we're not here to give advice, obviously, on a live stream, but that's what I would do. If I was in that situation, I would trust that decision-making process was going to make that. And like you said, you got to start where you're at. You can't start being the healthiest person. You just start where you're at, and it'd help.
Yeah, exactly. You know, and what's so awesome too is that when you're tasting your urine, when you're drinking it, it's this incredible feedback for your body and for you as to what you're eating and what foods you're choosing. I've noticed that cooked foods, especially like really cooked, like a stew that's stewed all day, or like a spaghetti sauce that's stewed all day. I know this is like too much for the viewers, but anyways, it can make the urine smell not so good. And, but I've noticed, like when I had sushi, right, I had raw fish, the urine was fine, you know, or then I experimented with raw beef and again, fine. But it seems to be that cooked foods seems to really make it not so great.
Yeah.
So that's something to keep in mind. Yeah.
Yeah, well, anything that would normally make, so when people have lots of aromatic foods or heavily, like curries, for example, you know, you can smell that on your skin, right? Or your breath or whatever. Like, it doesn't smell bad, but it's noticeable. Like you can notice a scent. And that's obviously going to be in the urine too if you're not filtering properly, or for whatever reason, it's probably just makes sense that it'll be there. Do you think it's a sign that it's not as good though? Because I'm not taking it to mean that. I'm just taking it to mean that it's noticeable in odor. But what do you think, Amy? Do you think it necessarily means that it's not as good, or what do you think?
Well, yeah, I mean, like I do acknowledge that there are benefits to cooked foods, especially in certain circumstances. And I eat cooked foods and raw foods. Um, but yeah, like it's pungent. Like when you cook foods, it makes it very pungent, because like cooked tomatoes, raw tomatoes are, subtle flavor, subtle smell. When you cook them, like, whoa, that whole smell like fills your kitchen. So it sort of like concentrates the food, makes it very pungent. So then, so yeah, so that I guess would make the urine smell that much more. So, but does that mean it's bad for you? Maybe not, but like when you taste your urine after you've had just like some water and some fruit, it's really not bad at all. And like I said too, I'm not saying you have to be vegan in order to do this, a raw vegan, because like I said, I've had raw sushi, raw fish, raw beef, and again, it's still pleasant tasting. I'd love to tell you a little bit about last night, just really quick. So talking about vibrational kind of a mind state that you're in, and then the urine sort of reflecting that. I threw my first ecstatic dance last night, and it was like a really big deal. I went in ahead of time and set up everything. So I ended up skipping dinner, and I had a piece of fruit, and then all night I was dancing. I was throwing my first event, very excited. Everyone was just like loving it. Everything was going smoothly, and a lot of my friends were there, dancing, drinking water, and then afterwards socializing. I made some hibiscus lemonade tea, which we all had, and I had some too. I had a little pastry. It was like a butter tart, supplied by the bakery. And anyway, so I went home very tired, but I was like, oh, I wonder how my pee tastes after doing this really high vibe activity where I'm so happy and like, oh, it was just incredible. So I peed, and sure enough, it was like almost rainwater clear. And tasting it, and it was like the temperature of my body. I'm like, wow, like that's incredible. And then so I ended up doing, I took the whole amount, like it was probably 2 cups, maybe more. And then of course the next cycle, the next time I voided, it was even lighter, even more amazing tasting, and really soft, and like, and I'm sitting there drinking it, like again, consistently having spiritual awakenings while doing this, and just saying, yeah, like this is such a beautiful liquid, and we've just been so led astray as to what urine actually is. And you can, the viewers can hear us talking about this, but you're not really going to truly understand it until you try it yourself.
Yeah. It's one of those epic leaps of faith, because Dave Armstrong, who does the Heal Me platform with me, he's one of those guys that's very, I don't know, like he's obviously thinks different because he's going through his cancer journey, and that's why we've got the platform, and that's why he's into all these different ways of doing things. But for him, that was a leap too far, doing the urine, that was a leap too far. But he's tried it, and he's not necessarily sold, but he's at least to push past that initial, like, it's just one of those things. No one can, I don't know. I mean, there's no other way to describe it. Like you say, no one can help you to do that. It can sound good. You can hear all the benefits, but you just got to like take that first step to try it. And maybe I'll just share my experience with that, because I'm pretty, somebody goes, oh, meat's better if you eat it raw. I'm like, sweet. Raw organs, raw, whatever, I'll do it. But urine to me was still one of those things that was kind of like, I might just ease my way into that. And so I eased my way in with, the first time I tried it was when I was actually about 21 or 22. And the reason I did that was that because I was doing a lot of martial arts, and I found out that some of my favorite martial artists did that. because of the hormone that it helps generate, or because of you slept through the night, you got your hormone stuff. And I was like, well, I don't know, if they do it, I'm going to try it. And so when I'd wake up in the morning, I'd have a protein shake when I used to take all that sort of stuff, sitting on top of the toilet, on top of the cistern. So that as soon as I woke up, well, just go to do a wee, it was like right there. I'd shake the shake and I'd drink it while I'm weeing. So first thing in the morning before training, I get a protein shake in. And then I was like, I'm just going to wee in the protein shake. And I did that and I couldn't taste it. So it's like, you know, when people first want to have raw liver or something, they'll try to hide it in other foods so they don't have to feel like they're tasting raw liver. So then I made a drink that I called a Weemonade, which was just the smallest amount of urine, but then you make a lemonade. So it's like fresh squeezed lemon, you know, a glass of water and raw honey, fresh raw honey. So you mix all that together, you've got your wee in it. If you're really focused, you can just kind of tell it's there, but you're definitely not. You're tasting more lemonade, way more lemonade than you are urine. And that was, for me, my safe way into, you know, into going for getting over the mental hurdle and letting myself know that it's actually okay and it's not horrible and it's not, I'm not going to gag on it or whatever. So I think it's good to know that you can ease your way into it in ways that don't shock your belief system or mind or whatever, or body.
Yes, very good tip for sure. You can absolutely mix it with juice or make Weemonade by Tom Barnett. Raw honey,
Yeah.
lemon, water, and wee. Is that right?
Yep.
Okay.
Yep.
I'll try that recipe.
Yeah, it's just a lemonade with wee in it, basically. You could do anything. You could make an orange juice and just put a little bit of wee in it, whatever. Just, yeah, anything that just masks it.
Yeah, that's definitely a great way to start. I will say, though, I did read a little bit about, you know, eventually once you start experimenting and do that, like encourage yourself to just try the taste of urine in your mouth and under your tongue, because there's so much sensory information going to our brain when we take food in and when we smell it and take it in. So it's so there's some benefit with just doing it kind of to graduate.
Yeah. No, you definitely have to graduate. Yeah, because it doesn't have the same property. Like you said, the feedback and stuff isn't there. So the whole thing is, the thing that people are scared of is the thing that has the most information. It's the scent, the smell, the taste. It's the way it feels in the mouth, you know, soft or whatever it is. That's what's giving the information, which you don't get when you hide it in, say, orange juice. But what it does is it's that gateway drug or whatever. It's like, it helps you get to the harder drug kind of thing, if you want to call it that. So it's like, this is me showing myself that I can ingest it. And then, like you said, you've got to then move to just urine by itself to have the greatest effect from it, for sure.
Yes. Awesome. Yeah. Something to note too, you said, or you didn't say that, but just last night when I took my urine, I had a really, really deep sleep because, of course, the melatonin in there and the hormones. There's like, so you got a really big hit of melatonin and yeah, so if you're having insomnia and issues sleeping and stuff, like it could be something beneficial for you to take at night. And your nighttime urine is typically more pleasant than the morning urine. So you could try that. You could also just like eat some watermelon and then try your pee after, 30 minutes to an hour after that. So using it on the skin is amazing for literally every ailment of your skin. So eczema, psoriasis, wounds of all kinds, stings, as we talked about, but you're also going to want to ingest it if you get stung. But yeah, rashes of all kinds, itchy things, wounds that won't heal. I know you have a story about gashing your hand open on a farm, almost to the point where you should have probably gotten stitches, but there was no hospital nearby. And so you did raw honey and you weed on it like every day?
Yeah. Well, every time I had to pass urine, I would wee in the cut. So basically it was, very open. So I just wanted to keep it clean and also just utilize the properties of the urine. So every time, so that was like 4 or 5 times a day, I peed into the cut. And then after I peed into it, I would also put raw honey into it to help stop, excess bleeding or whatever as well. and yeah, healed very, very fast. Like no stitches, no drugs, no, yeah, like nothing. Just literally urine and honey healed that gash in the hand, which was deep enough to have taken some feeling out of the thumb. Couldn't really feel it. So it was, yeah, and it went right through the whole hand, and the middle part was the deepest, and yeah, just amazing. I mean, yeah, I say I couldn't believe it, but I could. Like in the grand scheme of things, it wasn't a massive like gaping wound in the body. But having seen what that did, it just gave me that faith and that confidence that like if I ever had something that was even worse than that, having seen how fast and how well that healed, I'm like, wow, I've just got so much faith in the body's healing ability from that. Like if I had a massive, massive wound, I would do the same thing.
Yeah. Yeah. Unbelievable. So good. Yeah. Yeah. Someone said, are we, no, are we alcohol free? I think I could speak for Tom. Yes, we are.
Yeah.
But okay, so sorry, I got distracted there. So your gash, amazing that, you know, cause you kept it sterile, right? Well,
Yeah.
I'd love to tell you about what I used urine for this past year, which was this really, really stubborn health issue that sucks, but I'm going to be an open book, because if this can help someone, then I'm going to do it. Okay. So I had this, this kind of cluster wart on the top of my foot, like right at the bottom of my ankle on the top of my foot, like in a really visible area. And I had it for a lot of years, but it was just really like small, like barely noticeable. No one could notice it. And then I decided, you know, I'm going to get rid of this for once. I went to the doctor, and they then sent me to a specialist. This was before I knew about urine therapy. And they did the cryotherapy, right? Which is where they use the like really cold gun thing, and they blast your wart. But what happened was the wart just like spread out in a circle. So they just like blasted it, and then it just like moved aside in a circle. Anyways, so it was really painful. It didn't work. A couple of years go by, and I'm like, or I think another year went by for it to heal, because it was a terrible wound. But it was still there. And I said, I need to take care of this. So then I did compound W, which is just ridiculous. And it just kind of burned my skin. Okay, awesome. So I had to let that heal. And then I looked up, obviously, natural remedies. And I did apple cider vinegar, which can be really useful for warts. So I did apple cider vinegar, but then that started burning my skin too. But it was transforming the wart. Like it started to get black, and then it looked like it was going to fall off, and it did. But then underneath was like a perfect like replication of the wart. Like it didn't work at all. This thing was so stubborn.
Wow.
I was so frustrated. So at the Soul Shine Festival at the end of September, Amanda was there. I said, Amanda, can you help me with this? Like, so she looked at it and she said, okay, you did the apple cider vinegar. Okay, it didn't work. All right. Aged urine. I said, aged, really? Yeah. Okay. Keep it wet like all the time. She's like, yep. So did that, aged the urine, and kept it soaked in a cotton ball with a bandage. What's that?
How long was the aging?
How long did it take?
No, how many days aged was the urine that you used?
Probably about a month. Like I started using it right away until it aged, but I think about a month, and then probably 2 months at the oldest. Yeah, and it took a long time, but it worked. I kept it wet. I used a little dropper, like I had like a bandage with the cotton ball in it, and I kept the cotton ball wet. I would just take like a dropper and put more in it, like throughout the day, change the dressing, whatever. It's absolutely gone. And this was like years trying to get rid of this stupid wart on my foot. So yeah, it's incredible like what you can do. So someone else asked in the chat, cold sores, can I use it for cold sores? I don't see why not. And what you should just do is just, you know, use a cotton swab, keep it wet, put a Band-Aid over it. And yeah, you can even overnight soak cloths in urine and put it over your foot, say, and put a bag over your foot. If you have like a really bad issue, rash, athlete's foot, whatever. Yeah.
Yeah, so, it's a very strong. So when I did the foot soak, there's different ways to do it. For example, so you're talking about using pretty much a poultice, or just, you know, like soaking something and strapping it to the foot. If you have saved So you need a few liters of it to do a foot soak, because if it's just, you just pass urine, you don't have enough to fill like a foot soak tub and put your feet in. So I did it with enough to to have my feet fully soaked, right? So it took a couple of, I don't know how long that was, but it's like, you're talking pretty much a few days to a week's worth of saving. Few days anyway, whatever, it doesn't matter. And then completely submerging your feet up to the ankles. And I got quite light-headed, actually. It was great. I mean, it's obviously, that's not a bad thing. It's just showing the effect, you know? It's like, you're absorbing so much of whatever, minerals, salts, whatever it is that's happening there, that's changing over in your body, because the information that's brought in is just going to help do something in the body. I have no idea what it did, but the fact that I got like a bit kind of like up here just shows how powerful it is, you know? Like if you mega dose a magnesium foot bath, you might get a similar effect. So it's just showing that it's, you know, that's coded in the urine. It's just, I actually couldn't believe that I got that much of an effect in my head from that.
Wow. Do you think that was maybe the hormones mostly?
No idea. Yeah, I have no idea. It'd be really interesting to find out. But again, it was a lot. Like that was, how many liters was that? I had a 2-liter jar. I think it was only 2 liters. Yeah, might not have, or 3, but minimum 2 liters that was.
And it was a little bit aged, you said?
Yeah, well, a couple of days, because it took a few days to fill up the container.
Yeah, yeah. And so every like day that passes, there's more stem cells apparently too. They multiply, which is really
yeah, that's right. Yeah, so yeah. Anyway, different ways to do it. Different ways to do it on the feet, for example, because I remember when I had really bad tinea, which is athlete's foot in between the toes, and that was when I was early 20s again, when I first got really sick, and I was having all these mercury toxicity symptoms and stuff, and that's when I first also learned that you could use it for fungal stuff and put it between, like, wee in between your toes, or wee into a cup and then get like a cloth and then rub that in between the toes, so you're kind of like keeping a soak there, and it really, really helps.
Yeah, I've definitely heard it really, really helps for the itchy feet, whether it be tinea or something else. Yeah, very cool. See, and it's so amazing. We have this perfect medicine on board at all times.
Yep.
Just so liberating, which we talked about a lot in the first live. So if you're curious, you definitely should check that out as well for the viewers.
Yeah.
Okay, so we've got like a couple questions here. There's let me just check this out. What about ringworm aged urine as well?
I mean, technically it can. I don't know. I've never seen people use it, but I mean, similar to tinea, that's a fungal thing. Ringworm, like a lot of the psoriasis and eczema, that's all got a fungal element to it too. So I don't see why not. I just haven't directly tried it with a ringworm situation. Yeah.
Like I think I have heard that aged urine. Now, I've never drank aged urine. I think that would be like, woof, that'd be quite challenging, but I know people do it. But you can also do an enema with aged urine, and that is supposed to help rid your body of parasites. So I think there's probably value in that. If you were, if you were feeling like maybe you're dealing with parasites or parasite overgrowth, and you were really, really keen to get rid of them, it might be better to, instead of spend your money getting, all these expensive things, or even using, something like turpentine, maybe it would be just better to age your urine and slonk it back and get rid of the critters.
Yeah, I think Amanda said you're not supposed to drink aged urine a lot. You'd only have a really small homeopathic amount of that. It's more for topical. But I know also that I've heard from people that have healed their like horrible gut issues from just using aged urine. So I think it's a matter of be sensible, or listen to your own body, go slow with stuff. But I don't think there's any rules, to be honest, like, because I keep hearing different stuff. I think there's general guidelines, but then, I've heard people heal from stuff that you just go, oh, I don't, you know, if they had have said, hey, I'm going to do this, what do you think? You'd kind of go, oh, I probably wouldn't do that. But they've never had asked that question and they've done it. And so in hindsight, it's like, was the amazing thing and led to a miraculous healing. So yeah, I just think if you're called to do something or you're desperate, you know, really consider that it's, there could be an answer there, even if it seems like it's, you're not supposed to do it, even with, you know, like drinking aged urine, for example.
Right. Yeah. I think that's good advice. Just, it's really practical just to kind of maybe go slow, especially with the aged urine.
Yeah. Not because it's bad, but just because it's strong, right? Like the effect that it has is really strong. You might just be, I don't know what had happened. Maybe you'd be vomiting a lot of, I don't know what would happen, but my understanding is it's not bad for you. Like it's not like poisonous or toxic to the body. It's just that the effect is very strong because, like you said, everything multiplies, like the stem cells and everything multiply over time. And it's definitely got us, that does have a strong odor, right? Like urine is pretty fresh and nice, especially once you're used to it or you're healthy or it's symbiotic with your own body. But aged urine is pungent for sure.
Yeah. Yeah, you're reminding me, there's actually kind of like a correlation to high meat a little bit.
Yes.
This, right? Because like when you have urine that's like 2 months old, it actually reaches a point where it doesn't smell so bad anymore. Whereas like fresh urine doesn't smell too bad. And then when you age it, it's like there's this time it just goes up and it's really, really stinky. But then, yeah, at a certain point it transforms and it's not as smelly anymore. And then so same thing with high meat, right? Where it kind of goes through a process of being really, really, really pungent and then not so bad anymore. Is that right?
Totally. Yeah, I love that. Yep.
Yeah. Interesting. Yeah, there's just so many correlations in nature and yeah. Which is so awesome is when you truly learn about how things work, then you start to see the patterns everywhere and you see that everything kind of operates in the same way.
Yeah.
Yeah.
Yeah, nice one. Yeah. Thanks for that. That's
Yeah.
cool. When you're saying that, I'm like, oh my God, it is exactly like that. It's like what, and now I'm trying to think of what that process is because in the meat, it's the bacterial levels, right? But in the urine, it's not necessarily bacterial because it's not like urine is an antibacterial by itself. So then I'm wondering like, what is it? What's the property that goes through that bell curve kind of a thing? But very interesting.
Mm-hmm. Well, there's like mold spores and bacteria in the air and everywhere and in a bathroom and so on. So you could say that maybe some microbes kind of get in there and do their thing and then it sort of balances out at a certain point,
Mm-hmm.
perhaps.
Yeah. Mm-hmm.
Yeah. Yeah. Interesting. Okay.
Yeah. I like how these last two chats were just like thinking out loud as well, rather than trying to be like we know all the answers and we're only given like facts and stuff. We're actually just exploring things. It's good.
Yeah. Yeah. It's my favorite kind of chat. Absolutely. Okay. So Desiree says, can you use as a mouthwash?
Yeah.
Yeah, I have for sure. And you know, you think of it, it's like it's your it's the water that's perfect for your tissues. So like a second before you peed, your urine was like the blood in your tongue. You know? So it's you know, when you think about it that way, it's not really that gross. So yeah, you can use it as a mouthwash as well. And gosh, something I used to suffer from, which I haven't anymore, which is so great. But I know a lot of people do suffer from, there is the mouth ulcers, like not on the outside, like on the inside, you know, where it gets kind of like a white sore and it's very painful. And then like food stings and it's like, it's awful. I think they're just called mouth ulcers. And mine cleared up when I started drinking magnesium bicarbonate, which really helps your gut. But if you don't have access to magnesium bicarbonate, you could certainly use your urine swish, and it just helps to heal all kinds of wounds of any kind. So that would be helpful for those suffering with mouth ulcers.
Yep, totally. And then just you mentioned it earlier as well. Sorry, my phone's going to die. I'm just going to plug it in. A lot of people have used it effectively for teeth and gum issues as well. And a lot of the times the ulcers are in the gums. They're either in the inside of the mouth, like in the inside of the cheek, or they're actually in the gum, you know, in between the cheek and the gum and the teeth and that too. So you can definitely use it for anything mouth related for sure. Some people, again, like I've got to bring it up because people probably think it if they haven't tried it. They're like, but if I swish urine in my mouth and then like I spit it out, like surely my breath, or if I go to kiss somebody, it'll be like pee-pee breath. And then, so they're probably going to be thinking that, right?
Right.
So,
Like maybe for the first few minutes and then it's washed away.
yeah, I was going to say, it's like, it's not a residual thing. So it does definitely, you'll notice, you're like, I can tell there's been urine in my mouth, like there's no doubt about it, but it doesn't linger for very long. You could also rinse after that. So I would let it, after you've done your mouthwash and spit it out, I would at least give it a minute to like let all the energetics and that do their thing. And then you can rinse it out with fresh water. And then after you've done that, maybe even something else like anything that, like maybe choose some mint or something, you know, and then swish and spit out, and then you won't have any residual. I mean, I'm just talking about if you're about to go on a date, like you're like, oh, I've just met the love of my life and I'm going to go on a date. And then it's like 20 minutes of arriving, just like, I'll just swish my mouth with urine. Maybe that's not the best time to do it. Or if you do want to do it, you would just swish your mouth out after that to be sure. But I would actually, if I put money on it, I'd say 20 minutes, you're probably not going to smell it anyway, even if you didn't rinse it out. So, yeah, just because I just know that people, if they're not used to this stuff, their mind's going straight to that. You know, like, can people smell it on me or whatever?
Yeah. Yeah, I know, right? Yeah, definitely. And then when you're swishing with it in your mouth, you could get that homeopathic dose as well, which is so powerful. So that could be a really great way for people to start, is just rinse with it, like swish with it, spit it out, and see how it is. Yeah. Yeah, very cool. But yeah, so what I want to do coming up is just do like 3 days of eating just totally raw food. So just like raw vegetables, well, carrots and fruit. And I love raw carrots, but and then raw meat, raw fish, and then start a 3-day looping fast. So that's what I'm going to do upcoming.
Cool.
Yeah.
Yeah, you have to post in your stories your how you're going through that. Yeah, I've never done it. I assume that you don't get very hungry or thirsty because of the your body's getting its own sustenance. Yeah, be interested.
Yeah. Yeah, I did a milk fast and I felt like I really wanted to chew food. Like it was very, like I was like, I'm very nourished from the milk, the raw milk, but I just want to chew food. So we'll see maybe if I still have that desire, or if that isn't there. So yeah, we'll see.
Yeah, awesome.
Very cool. So let's see what else. So we covered topical stuff for the most part. We covered, using it for your hair. Yeah, doing enemas. Aged urine enemas are apparently quite powerful. Depending on how old it is, like we said before, go slow, use moderation, maybe cut it with half distilled water. Make sure it's warmed, not boiled, but, warmed to your body temperature when you do it. I find the urine enemas are actually so much easier than coffee enemas. I can't really retain a coffee enema, but the urine enema is just like so natural. It's just your body's waters going back in, and it's really gentle, but powerful in the same breath.
Is there a certain time period you would hold that for? Because I remember when Amanda, we talked about that. I think she was talking about aged urine enemas, that you can't hold it in for barely any time at all. It's like, yeah, it doesn't want to stay there. But with fresh urine, does it stay for a while? Like, is there a certain amount of time you would aim for? 20 minutes or something?
Yeah, like 20 minutes or so, 15 to 20. I've only done like maybe 4-day-old urine enema. That's about as old as I've done. Yeah. Okay, so you can try that. And as Amanda said, which Amanda and Tom did an amazing live together, you guys should check it out. All about urine therapy. And Amanda did an incredible like slideshow with all the facts. And she said, oh no, I lost my train of thought. Yeah, that she's going to write a book all about enema. Hooping and Looping is the book that she's going to write. So that's going to be really epic to read. But she also says too, you can do injections. which I have not done, but apparently there's lots of therapeutic benefit from injections, which John Armstrong did do a little bit of. So there's that as well, but that would be kind of advanced urine therapy. Yeah, so we've got like a few newbies in the chat that are like, what's going on here? We're drinking our urine? What? Is there a reason it leaves our bodies? That's kind of a neat question. Okay, like, is there a reason it leaves our bodies? Well, you know, our body is always wanting to reach homeostasis. And so, you know, when we eat food, we have nutrients, and sometimes maybe at a given time we've got enough magnesium and we can dump some magnesium, or we've got enough selenium, we can dump some, or, you know, we've got enough of XYZ hormone, etc. So, but yeah, do you have any thoughts, anything to say there, Tom?
Yeah, well, everything cycles. That's the thing. Nothing stays. Like if a body of water stays a body of water, it generally goes tepid or whatever. Everything cycles through. Like oceans cycle through too. It goes ocean, sky, rivers, creeks, whatever. You know, like everything cycles. So I would be very surprised if waters didn't leave the body. Because if it's coming in, it's going to go out.
That's a good, yeah, very well said. Yeah, and like too, our urine is basically kind of like distilled water. I mean, distilled means there's nothing in it though, and that's not really true, but it's like purified water. Or is that even really legit to say?
Yeah, it's very well filtered. It's like what the earth does. Like the earth filters and purifies waters, so that that's what our body does. You know, it's like.
Yeah.
Because most of the waste, I think people are confused. Because most of the waste goes through the bowel. The urine isn't necessarily waste. It's called waste, but that's like, you know, good old science and medicine calling things like, oh, you've got a useless appendix. No one knows what it does. It's like, that's one of the most vital things in your body. You would be an idiot to get that removed. And, you know, it's just that way of thinking. So while, yes, it's called waste in your primary school textbooks, that doesn't mean that it is waste. Just because it went through a typewriting press doesn't automatically make it truthful information and useful information. So, yeah, I think it's reframing that. Waste goes through the bowel mostly. And, yeah, your urine is like purified, distilled, energized, ionized plasma water.
Right. Right. And as we said before, it may have the metabolites, and those of you hearing this, you should definitely check out part 1 where we explain this, where you do get like the metabolites left over in urine, which is essentially the so-called toxins in food that we eat or whatever, or the pharmaceuticals we're taking. The liver neutralizes and processes those toxins, breaks them down into their original elements that are harmless, and they're the metabolites. So it's almost just like the mirror of the original assault kind of thing. And then, yeah, our body processes most things out in the stool. And then we also exhale wastes, and also our skin will get rid of. I think the skin would be probably like the last resort, right? Like it's not ideal to get rid of toxins through the skin, but our body will do that. And that's why we have acne, everything else. Yeah.
Yeah, in extreme states, yeah, for sure. Like it does always eliminate toxins, it does, but it's always in a balance point. So if your skin is bad, it's like, well, yeah, your internal organs aren't doing their job.
Yeah. Yeah, for sure. Okay, interesting stuff. Let me just scroll through. I don't know how much time we have left. Well, you know what? Do you remember the question I sent you before I tagged you? And it was like more of a philosophical question. It didn't have anything to do with urine therapy.
I remember. Yeah, I don't remember what it is. What's that question?
Let's tackle it because I think everyone's kind of, let's just end on a philosophical note if we can. Because I was struggling with this too, and I really felt like I overcame it. So I hope we can answer it well. Okay, so I have a request for your chat with Tom. This is a big one. Could you please discuss understanding the line between being detached from the modern world and all of its distractions, and being a non-participant who is hiding from reality? In other words, where is the balance between coming into yourself and not being part of the world's BS without hiding from the experience and losing all opportunities for growth? I see being part of this illusion and completely hiding from it as both being bad choices. So it's both bad choices by being part of the illusion and then like hiding from it, not wanting to see it, right? So how do we find the sweet spot in life?
Didn't you write an answer to him or something?
I did, yeah. Yeah, I basically said like, essentially it comes down to acknowledgement. Like when we're upset about the world or just like angry at the world, and how do you reconcile that? How do I live in the world and know how terrible things are and still be joyful and you know, be engaged, but not be like so attached to it so that every wind that comes by, it rattles you. So you want to become calm like a cucumber, like Tom Barnett. So I said, essentially, it comes down to acknowledgement, seeing the dark forces that currently have a hold on our world, yet still finding joy. It's about looking darkness in the eye and then not being fazed by it because you know a higher truth. Being unaware, you can still be manipulated by these forces. So that's not a good choice to just choose to be unaware. But when you're aware of them, you rise above them. This way you can be in the world, but not of the world. You can be engaged, but not attached.
That's perfect. That's what I would say. Yeah. I mean, that's an old biblical phrase, be in the world, but not of the world. And that's exactly what I would have said as well. It's simply that if you are ignorant to stuff, that's not a good thing. But if you're ruled by it, that's not a good thing. So it's being aware of, but not ruled by it, being the mastery of your own, to have dominion. So it's like, if you have dominion, well, then it doesn't matter about the entities and that. It's just they're there. To the degree that you're not willing to acknowledge or recognize something is there, or even something has power. Like some of these entities are very powerful. They're very intelligent. Like try to put this system in with all the inversions and all that. Like an idiot didn't do that. So it's like an empowered individual though is willing to recognize that. Another way to say that is if you look at society, Australia in particular, we have tall poppy syndrome, where we don't really like people doing better than us. So then if somebody's like, you know, I don't know, doing well on social media or something, you'll go, oh yeah, but they don't really know their stuff, or they've only got all those followers because they're pretty, or I know more than them, or just something like, it's some way to like, you have to have something up on them because you feel disempowered by them. Whereas an empowered individual will just go, holy crap, look how well they're doing, good on them. And nothing else, no negativity clawing at it. And that's how it is with recognizing the evil in the world, is recognizing it because you're not disempowered by it. And as soon as you start to try to turn away from it or say, yeah, but that's because they're evil or like whatever, you know that there's part of you that is weak, that can't handle that being in the world. So then it's just, yeah, I think your personal response to stuff is your gauge to where you're at. And as soon as you can just recognize stuff and recognize that it's not you as well, and just be okay with it because you're resolute in yourself and what you're doing and what you're creating, then it's like, it can be whatever it wants to be. It doesn't matter. It doesn't affect you then. And that's that place, that's being in the world, but not of the world.
Yeah, definitely. Great answer. Yeah, like, and two, something you taught me a lot was really connecting with nature. And it was something I thought, well, I do that, you know, but thinking more, it's like, yeah, when we connect to nature, nature is like the most direct physical manifestation we have of the divinity of this world. When we see all the perfectness in nature, then we can see, you know, the divinity of this reality. And I just, you know, I love the affirmation, right now it's like this. Right now it's like this, you know, right now the world has, there's craziness in the world, and there is some kind of dark force that has had a stranglehold on humanity for quite some time. But, you know, now we're coming up out of it, and we're writing this incredible story, you know, of good over evil and triumphing and finding ourselves and evolution. And so yeah, like right now it's like this. And I think for me, what really has helped me is to realize the bigger cycle in all of this. And I've talked about this a lot in my lives, about the cycles of consciousness, the cycles of the yugas, and this is from the Hindu yogic path. Essentially, that we are coming out of the dark ages, and that a golden age is absolutely possible for humanity, but we're just not there yet. And you know, and we desire that. We desire to have a certain reality where all of us can express our highest gifts, and you know, we're just operating at our highest potential, and we're working together as humanity, and we're making incredible inventions, and just, yeah, like being in that just beautiful golden state. But we're not there right yet, but that's a possibility. Like that's on its way.
Yeah,
So
but you
that's
can be
really
there
happy.
with the state of being, right? Like you can embody that. Like it's like in when people talk about doing manifesting and that, they're like, I'm going to have in my, like, what most people do is they affirm that they don't have it and keep pushing it away.
Right.
But as soon as you embody it, you're like, I am wealthy. I'm grateful for being this. I'm grateful for the ease in my life. And then you are that. And then funnily enough, that happens around you. It's like the back to front way that a lot of people have it. That golden age, it's all possible because it's all in here. And when we start resonating at that frequency, we are in the golden age. We have passed over that thing, but in order to get there, we had to let go of what was binding us to the lower whatever realm frequency, whatever. And so it's like, I don't think it's like we do, if I do this and then I rub that way and then I say these words, I'll get there, because then you're saying you're not there. But as soon as you live like you are, then you transcend all that stuff that binds you to where you currently are, and you're already embodying that higher frequency. And then you like, that's how you get there. It's well, I think, I'm not saying that's the answer. It's just that I know from experience from other stuff, thinking that you are not there is definitely means you're not there, and you're not occupying that realm yourself. You know what I mean?
Yeah, no, I do. You're right. That's a really good correction for sure.
Oh
Because
no,
it
it's
is.
not a it's not a
Well,
correction. It's a, but what I guess I mean as well is that it exists because that's how, I think the paradox to it all is that if you can't occupy that because of what's around you, then you're not that. I think that's the other way I'm trying to say it, is that if you can live in a world that has pedos and has chemtrails, if you can live in a world and be shown that and still operate there, then you're there. Because it's these other things that are testing us and offering for us to stay in that frequency. It's like, no, there's pedos and I'm angry and this is all fucked, and that's not a golden age, or a, whatever you want to call it, like that higher frequency. The high frequency is occupied when you're tested and you pass a test, which is that dude's a pedo, that dude's trying to ruin the financial system, that dude's pouring chemicals into the lakes, and that doesn't pollute your waters. If you can keep your waters pure and clear with that around you, then you're already in that golden, whatever, higher frequency.
yes, yes. And it's, yeah, we kind of take this step first, and then that reality presents itself.
Mm-hmm.
Which it is, yeah, it is so interesting. And it's, yeah, it's this beautiful like up leveling of trusting this experience. And like you said, like I am rich, you know, like look at my rich like life of, you know, like Bob Marley said, like my riches is life. And it's, you know, it's not possessions, it's not all of these things. And so like, yeah, yeah, like it is beautiful. It's like an up leveling. I really feel that. Every single time I trust and then see that everything is okay. And even when things come into my reality that kind of push me off course or bump me off course a little bit, you know, I might go off course, but then I can reflect afterwards and see like the perfectness in that lesson that just came. And I feel like that's really what's happening for a lot of people, is a lot of lessons are coming really fast for people to kind of to come to the surface to deal with, and
Yep.
so that we can, you know, collectively all kind of get there, because that's, you know, that's what we want. We want that for everyone. We want that really great feeling for everyone.
Yeah, I do too. You know, like I keep getting things where so an old analogy is that the less wealthy you are, really, the more you have to surround yourself with, I need more gold, I need more jewelry, I need a bigger house, I need a newer car, I need to feel wealthy. That's the extent to which you are not wealthy. Paradox being, you can have all those things if they don't bind you. You can be wealthy in here and have gold and jewelry and fancy stuff, but you're not bound by it or attached to it. That's okay too. But you know, I still go through periods where things aren't perfect because I've loaded my plate up too much, or I don't have a house, and then this is all too hard. It's just like, and then I fail that test because that's perfect anyway as it is. And then I'm like, oh no, so that when I know that I've failed, I haven't passed that test to have that non-polluted internal environment, then I just recognize it. I don't beat myself up about it. I give a prayer of gratitude and forgiveness, and then I move on. And then as soon as I do that, it's like restructuring the water to that perfect state. Because I definitely, like, I know sometimes people might assume that I talk about stuff and therefore I do it all the time, but no, I don't. You know, like I still pollute my waters all the time, but I recognize when I do it, and then I've got this, a more of an understanding of what I'm meant to be, you know, moving towards. And it's a choice, like what we spoke about earlier, that woman who healed through that 2-month looping. It's like the first thing is she wanted to heal, and then she did the urine as well, which helps. And so for me, it's like, I want that higher frequency. I want that higher realm, that higher, that golden age. And it's not like a want, like I don't have it, but that's my intention, is to be that state. So that because the intention is there, it's easier for me to go through and process things like, oops, didn't do that right. Or offering forgiveness to myself, or having gratitude for the test that I was just given, which I was 10 minutes before, I was like, this is shit. Like, why does this part of life have to be difficult right now? It's like, oh, it's not being difficult. It's just a test. It's a gift. It's an offering. And I come back to that, and then things improve immediately. So you know, I think all of us are on that journey. I don't think we would be here if we weren't.
Yeah. Yeah, absolutely. We want experience.
Yeah.
Yeah.
Yes.
Yes. Beautiful. Well,
Cool.
I think that kind of wraps up our part 2, urine therapy, ending with a little bit of philosophy and perspective for you guys. Yeah. The Oxygen Lounge says, love your honesty and rawness, guys. Thank you so much.
Yeah.
So everyone, you know, try urine therapy. If you just, all you want to do is just put a little bit on your skin, or do a foot soak, or put it in your hair, or even go, you know, a little bit more into it and do some urine sniffing, or looping, or just a couple drops under your tongue for a homeopathic benefit. Give it a try. I really feel like it is a key to where we're going, and for people to heal themselves, and for us to just be empowered that we do have this ability to heal ourselves, and everyone has their own perfect medicine. You don't need to go and see a doctor or a pharmacist, and we can take back our sovereignty and our ability to heal.
Yeah, absolutely. Yeah, well said.
Yeah. Cool. Well, if anyone has any questions, feel free to message either myself or Tom. And you can always reach out to either of us if you guys are struggling with your health and you want to dive deeper. You can always reach out. So
yeah, message
people...
me, because I don't get most of the messages, so you probably won't get a response. Not because I don't want to, it just doesn't happen. So.
Well, where do people get a hold of you? Your email?
No, I haven't even really looked at emails in the last couple of weeks either.
Okay.
Yeah, too much. No, well, because everything I do runs through the Living Free movement at the moment. Like health consults, I don't do them anymore. Everything goes through the platform. Yeah, it's just I just get too many things to be able to check messages and that all the time. But occasionally I do. Like if I see them, I'll respond to them, but they just generally won't be timely. So
yeah. Okay.
If it's urgent.
Well, fair enough. Yeah. Appreciate all the work that you're continuing to do as well on that platform.
Yeah, for sure.
Yeah. All right, Tom. Well, you have a beautiful rest of your day, and thanks everyone for joining.
Thanks, guys.
Okay. Bye.
Dan.
Bye, Tom.